Thank you for taking time to join us today. As your corporate insurance partners, we are excited to bring you this important session on cancer awareness. As we know, early detection and understanding are key in the fight against cancer. And in today's webinar, we aim to empower you with the knowledge and resources to make informed health decisions. I would now like to extend a warm welcome to Dr. A.K. Dewan, who is one of the leading oncologists and Director Surgical Oncology at Rajiv Gandhi Cancer Institute. He has been a cancer surgeon for over 40 years. He gained experience in institutes such as Tata Memorial Hospital, Mumbai, and Safdarjung Hospital, Delhi. His areas of interest include head and neck cancer surgery and breast cancer surgery. On an average, he conducts 120 major and 100 minor cancer surgeries every month and has been involved in over 18,000 surgeries in the course of his career. So without further delay, let's get started. In case you have any questions and anything comes to your mind during the session, please hold on to them. We will have 10 to 15 minutes in the end to address any queries that you may have. All right, let's begin with the session. Over to you, sir.
Thank you, Ms. Shikha ji. And probably today, first time I'm talking in front of the insurance people. And I came to know all the details about hips just few minutes back. And here I'm a cancer surgeon, as she's already introduced me. And I think let us begin and be cancer aware. And I'll start with a short, it is not a story, but a true story. I have named it as MBA friend. I had a genius school friend, a girl. She used to have supari at the age of 12 years of age. She started smoking in college. She was a super intelligent girl. She chose commerce, became a successful senior executive in MNC, became a night owl. रात को जागना है, काम करना है. Got married, never started family. And gained weight, always glued to computer, no exercise, and busy whole day and night. Later, she became the CEO of a big company. She used to have junk food, non-vegetarian daru in non-night parties. जब भी मिलो बात करो तो टेंशन बड़ी है यार, टाइम नहीं है. And the school friends always envied her as she owned a 5-room palatial house. And everybody used to say she's Sarv Gun Sampann. And I agree. In retrospect, I say she was Sarv Gun Sampann. She used to have supari at the age of 12 years, smoked in college, became a night owl, gained weight, never started family, no exercise, enjoyed food, non-vegetarian daru, and believed in free sex. And at the age of 48 years, she got breast cancer. And at the age of 55 years, she developed lung cancer. Rest is all history. So these are all the qualities to hook on to cancer. Now, if you ask, I'm sure you must have seen cancer patient, and maybe somebody in the family might have had cancer. But I don't know how many of you know what is actually cancer. But you are all aware that cells are the building blocks of our body. You see, our body is made up of different systems, say cardiovascular, gastrointestinal, brain. These systems are made up of different organs, and organs are made up of tissues and tissues of cells. Cells contain genes, genetic material. which control some protein molecules within the cell. And if there is any genetic aberration, genetic alteration, the cell becomes an abnormal cell. And what it does is releases abnormal protein molecules and proliferates. सेल की फितरत यही है कि भैया उसने एक से दो होना है. But it proliferates in an uncontrolled way and it forms a small tumor, means swelling in our language. And if that tumor has got tendency to spread in rest of the body parts, it is called cancer. But the swelling could be non-cancerous and has got no tendency to spread to rest of the body parts or eat away the normal area. These are called benign tumors. So why it is important to know about cancer? See, since I'm a head and neck surgeon, I have more focus on head and neck surgeries. Most important is the aesthetics. Everybody is scared of disfigurement, scars on face, public appearance, inability to eat in public, and altered food habits, altered speech, psychological impact, altered sexual life, and changes in interpersonal relationship. And of course, as an insurance man, you will agree with me that you don't want to insure a cancer patient. And there is discrimination in jobs. There's a lot of social stigma attached to it. And they are physically and mentally traumatized people. There's a lot of financial loss and there are spiritual issues. So, whole lot of problems with this disease. I have picked up these figures from Times of India, February 2022. India sees 13.2 lakh new cases of cancer every year. And there are about 8.5 deaths, 8.5 lakh deaths each year. It is estimated that the risk of developing cancer before the age of 75 years is about 10%. And the risk of dying from cancer is about 7%, which is quite high. And we have cancer registry, which says the top male cancers are oral cancer and lung cancer. Do you find something common in these? Both are tobacco related. Tobacco chewing and lung is related to smoking. Both are lifestyle related and preventable cancers. Top female cancers are breast and cervix. Cervix is the lower part of uterus. Female cancers cannot be totally prevented, but they can be early detected and you can lead a virtually normal life. Now, the next question is, what causes cancer? I've already said that tobacco is an important cause. Of course, pollution also contributes to cancer causation. You have to live here. And कई बार मेरे से पूछते हैं लोग, साहब यहाँ पर मेट्रो सिटीज में इतना कैंसर क्यों है? I think we are to be blamed. Our lifestyles and the pollution which we have is responsible. Diet, obesity, sedentary lifestyles are important causes of cancer. Then chronic irritation, maybe sharp teeth in the oral cavity, few of the viral infections, hormones, poor hygiene, pesticides, junk food. Some people blame it to mobile phones. Stress, I'll talk about it later. And people say that my father had it or my Masi had it, so it runs in my families. You see, genetics have got little to play. Only 7% of the cancers are genetics related. 15% are familial because you are sharing common food habits, common lifestyles, and just 15% are familial. But more than 80% are lifestyle related and acquired by our habits. Let me talk about tobacco. See, WHO estimates that annually nearly 5 million people die of tobacco related illnesses. 5 million means 50 लाख लोग मरते हैं तंबाकू के सेवन से. And it is projected that the number will increase to 8 million by 2030. And in India alone, it is estimated that 2,500 persons die every day due to tobacco-related diseases. And 27 crore tobacco chewers, tobacco users are there in India. So incidence is quite high. 35% of the population above the age of 15 years use tobacco in some or the other form. And tobacco contains about 4,000 chemicals, and 50 of them are known to be carcinogens. Carcinogens means cancer-producing substances. I will not go into the details of what type of cancers and what are the carcinogens, but they are harmful. Tobacco not only causes cancer, but is also responsible for heart diseases, blood pressure problems, cholesterol disorders, bronchitis, chest infections, low birth weight and premature babies in ladies who smoke during pregnancy. And if parents are smoking, then children are more prone to have chronic chest infections. You see, tobacco affects every part of your body. Skin, tooth, fertility, eye, ear, bone, you name any organ, it gets affected. And somebody asked me, what is the use of tobacco? What is the फायदा advantage है कि नहीं है कोई? And I said too, you see, government generates so much revenue from tobacco. And the other thing is that smokers never become old. Why they don't become old? I think you can understand. These people, they die quite early. Tobacco chewing, people who chew either tobacco or even non-tobacco products like supari, आजकल तो सब चीज pouches में मिल जाती है. These people develop white or reddish patches in the mouth. These are called leukoplakia or erythroplakia. And some people who regularly use gutka and supari develop submucous fibrosis, means shrinkage of mouth, and they are not able to open their mouth. And of course, all these things affect your gums, teeth. Unfortunately, in India, gutka is considered as a food product. और तभी आप देखेंगे कि सेलिब्रिटीज जो हैं एडवर्टाइजमेंट करते हैं गुटखा प्रोडक्ट्स की और पाउचेस में मिलता है. बट आई कैन टेल यू दैट गुटखा probably is more harmful than your smoke. What actually happens if you smoke? You see, within 10 seconds, there is a substance in the smoke known by the name of nicotine. Nicotine reaches your brain and it stimulates your brain and releases two chemicals. One is dopamine, which gives you good feeling, and the other is noradrenaline, which makes you alert and energizes you. तभी आपने देखा होगा बच्चे लोग जो है ना, वो एग्जाम डेज में स्मोक करना शुरू कर देते हैं। मे बी बिकॉज ऑफ एग्जाम प्रेशर, पीयर प्रेशर, के एक पफ ले लेते हैं, एंड दिस इज व्हाट दे गेट, forgetting what they are inhaling in addition to nicotine, the 4,000 chemicals, including 50 carcinogens. And then it becomes a habit. Nicotine is habit forming. And in that bargain, you have damaged your other body parts. People who smoke, you see, I have been a surgeon for so many years, and I am. Previously, I used to operate on lung cancers, and the lung of a non-smoker is like this. It is like a pink lung, but a smoker's lung is a black lung. You can see this. And these are actually bad posters somebody has sent me. Kissing a smoker is like licking an ashtray. And it is estimated that heart attack risk is twice in smokers than in non-smokers. So message to smokers is that risk is big, half will get killed in their middle age. 1/6 of them will die of lung cancer, and 1/4 are killed in middle aged, losing their productive life. And one cigarette cuts 11 minutes of your life. सो जितने भी स्मोकर हैं, अगर पॉकेट में एटलीस्ट सिगरेट रखी हुई है तो बाहर निकाल कर डस्टबिन में फेंक दीजिए अभी. एंड यू मस्ट टेल योर कलीग्स इफ दे आर स्मोकर्स not to smoke and not to chew tobacco. People who are smokers, they say, it's my life, let me smoke. I'm not interfering in your life. Why stop me? But they are giving second-hand smoke. Even in their breath, there is smoke particles which damages the lungs and other body parts of people who are around him or her. A second-hand smoke, this is called second-hand smoke, kills 60,000 non-smokers nationally each year. The second issue is alcohol. People who smoke, I have seen quite frequently, they'll be taking alcohol. Alcohol is linked to at least 13 cancers. Of course, my cardiology friends say that it is good for heart in moderation, of course, they say. But I feel that anything hurting your rest of the body parts and good for one organ is not a good thing to consume. It is linked to mouth cancer, throat cancer, voice box cancer, liver, breast, lung, and so many other organs. And alcohol and smoking is a deadly combination. The risks are much more. Then next comes is diet and cancer. Diet which is low in fruits and vegetables have been implicated in cancers of mouth, voice box cancer, and food pipe cancer. Even iron deficiency has been associated with throat cancer. Green tea is considered to be good and it prevents cancer. So you can have green tea. Fruits and vegetables, they contain phytochemicals which are protective against cancer. I'm sure most of you must be bringing food from home but many of the school children, college children, and I'm sure many of you might be depending on junk food rather than the normal roti rice. So junk food is also, of course, it is high calorie, high energy, but poor food qualities. They are linked to not only cancer, but also obesity, heart diseases, diabetes, and so on and so forth. There was a study in 1974 in schools when it was found that 5% of the children are obese. In 2008, it was found that the number has tripled, more than tripled. 17% of the school children were obese. And now, after COVID, the number has increased much more. So, obese children, 50% of them are likely to continue to be obese in their adult age or even middle age. The risk of cancer is more in obese people. The next question is electromagnetic waves, mobile phones, and cancer. There is a possible relation with brain tumors, some ear tumors, and even leukemias, that is blood cancers. I've seen people carrying three phone, four mobile phones. In each and every pocket, they will have some mobile phone. People who use phone or their screen time is more than 10 hours a day for more than 10 years, they are more likely to have cancer. Screen time means use of mobile, TV, and your laptops or computers. That is screen time. So try to limit that. I have seen even children being glued to mobiles and laptops. And it was estimated in one of the studies in India that school-going less than 10 years are using their screen time is more than 5 hours a day, which is quite high. People who use mobile phones excessively, keep in their pants, have got poor fertility. Women who have got high screen time have got high risk of miscarriage and morbidity in unborn children. The next question, which is quite frequently asked, is stress. Has it got anything to do with cancer? Stress has got no relation with cancer directly, but stress affects your defense mechanisms, that is, immune system, and you become more susceptible to cancer. But it does not cause cancer directly. I've already mentioned about viral infections. I am sure you must have heard of hepatitis B and C virus. They cause cirrhosis of liver damage, and these viral induced cirrhosis are linked to liver cancers. AIDS patients are prone to develop cancer. And there is a virus with the name of HPV, human papilloma virus. This is linked to cervical cancer. They say that 98% of the women with cervical cancer harbor this viral infection. So most of the cervical cancers are actually caused by HPV. And nowadays there is a vaccine available which can be given against this virus HPV to prevent cervical cancer. And it is given from the age of 10 years to 25 years. Even tonsil cancers have been implicated and caused by HPV. I've already talked about the poor oral hygiene, sharp, bad teeth can cause cancer. So, cancer is not an inherited disease, but a man made disease. Cancer is largely a preventable tragedy. Now, the question is, how can we prevent cancer? See, if you quit smoking within 8 hours, the carbon monoxide level in blood drops to normal and oxygen levels start improving. Within 48 hours, the ability to smell and taste begins to improve. Within 3 months, the circulation improves, the lung functions improve. Within 6 months, your coughing goes, sinus congestion improves, your fatigability improves, and shortness of breath goes. So the lung functions become even better. Within 1 year, the risk of heart attacks decreased to half that of a smoker. And within 15 years, the risk of dying from heart attack is equal to a person who never smoked. So quit smoking now, just now. Is there anything called a good tobacco? You must have heard of vaping and e-cigarettes. Government of India has banned even e-cigarettes. What does it contain, e-cigarette? It doesn't contain the chemicals, but it contains nicotine and few of the flavoring agents. When these are burnt in an electronic case, it is like pen only. What happens? Nicotine does its job, stimulates your brain. So you get addicted to nicotine. But nicotine addiction does not remain nicotine addiction. Either school children or college students, they then switch on to conventional smoking. So this is a way of switching to conventional smoking. So that is why Government of India banned even e-cigarettes. Question is, how can we prevent cancer? Avoid preserved foods. They contain nitrites, nitrates. Limit junk food. And there is a role of organic food, of course, is quite expensive. And whenever you eat fruits, use vegetables, wash the insecticides of all fresh fruits and vegetables. It goes without saying, avoid using indiscriminate estrogens. Why I'm saying that, I've not discussed it before. You see, menopause, maybe at the age of 50 or so, a God gift. Every lady has to achieve menopause. Ovaries stop functioning. The hormone levels drop down and they get symptoms like hot flushes, irritability, sweating. Those symptoms are menopausal symptoms. And there are changes in the body. But everybody wants to stay young and they start taking hormones, especially estrogens. And one is prone to develop cancers, especially breast cancer and genital cancers. They are estrogen dependent cancers. And then, of course, hold on to one partner. You will have less chance of acquiring HPV infection and cervical cancer. No junk food, weight control, stop smoking, stop chewing tobacco, go easy on alcohol, rather no alcohol. So there is a slogan, eat right, breathe right, weigh right, and live right, you will not get cancer. So if you don't use tobacco, the risk of developing cancer can be reduced by 35%. If you have proper diet, 15% further, that is 50%. If you control your weight and burn your calories, 15% more. So two-thirds of the cancers can be prevented. I've already talked about the vaccine, and I think you should encourage your clients that they should give vaccination to their daughters who are from the age of 12 to 25 years. Although the company walas, they say you can have the vaccine till the age of 45 years. And they are available with the name of Gardasil 9, Gardasil 4, and even Cervarix. Cervarix is nowadays not available, but Gardasil is available, and it is against HPV vaccine, HPV virus. Next step is early discovery, early recovery. If you pick up cancer early, you can recover early and you can virtually lead a normal life. So cancer is curable if detected early. एक मैं एग्जांपल देता हूं, सबके पास गाड़ियां हैं, कार सबके पास हैं, आपके पास नहीं तो बाइक होगी जरूर. अपनी कार की सर्विसिंग कराते हो आप, सभी कराते हैं 5,000 10,000 किलोमीटर पे, या 6 महीने हो गए तो सर्विसिंग, कार कोई प्रॉब्लम थोड़ा दे रही है, फिर भी आप सर्विसिंग कराने के लिए पहुंच जाते हो. क्यों कराते हो? सर्विसिंग इसलिए कराते हो कि कहीं गाड़ी सड़क पे खड़ी ना हो जाए. आज की डेट में तो प्रॉब्लम नहीं दे रही, लेकिन अगर रुक गई कहीं चलते चलते तो क्या होगा? तो अरे भाई, अपनी बॉडी की सर्विसिंग नहीं करानी चाहिए? आई कैन सी स्माइल ऑन योर फेस, बट आई थिंक it is important that we service our body also. That is called screening. After the age of 45 years, everybody should have health checkups at least once in 2 years. It doesn't cost much, maybe 5,000-6,000 rupees. I'm sure you can afford. If your cars can afford, your body can afford. And next is you should be aware of some of the warning signals of cancer. And these are with the mnemonic caution, CAUTION. I'll just enumerate one by one. If there is a change in bowel or bladder habits, means you never had constipation, diarrhea, but you suddenly start getting diarrhea or constipation, and your bowel habits change, especially after the age of 45, 50 years, or you have to get up at night 2, 3 times. So the bladder habits have changed. You must consult a doctor. A sore that does not heal, जख्म है कोई मुंह के अंदर है या हाथ पर है या कहीं बॉडी पार्ट पर है, which is not healing for more than 3-4 weeks, you must consult. Unusual bleeding or discharge. Unusual bleeding I have written with a purpose. You see, menstruation is not unusual bleeding, it is a normal bleeding. So if there is intermenstrual bleeding, or after attaining menopause you get bleeding, or bleeding per rectally, or through nose, through mouth, through ear, you must consult. Thickening or lump in breast or elsewhere. If there is a lump in the breast, especially if it is painless, you must consult a doctor. Indigestion or difficulty in swallowing. प्रॉब्लम हमारे साथ ये है कि इंडाइजेशन काफी लोगों को होता है, लेकिन सेल्फ मेडिकेट करते हैं, चलो भैया पैंडी खा लो और डाइजीन जेल पी लीजिए, ठीक हो जाएगा. 3 महीने आदमी यही करता रहता है. इफ देयर इज अ डिफिकल्टी इन swallowing, then he goes to a general practitioner who will also treat him the same way. So 5, 6 months have passed, and by the time you manifest with an advanced disease. If there is obvious change in wart or mole, तिल सबके होते हैं, mostly लोगों के होते हैं. तो तिल का अगर साइज बढ़ जाए, ब्लीड करने लगे या कलर चेंज हो जाए, you must consult a doctor. If there is a nagging cough or hoarseness of voice lasting for more than 3 to 4 weeks, if there is low-grade fever, loss of weight, loss of appetite, low-grade fever, especially it is lasting for more than 3 weeks, you must consult a doctor. I am not saying these are the warning signals, but cancer could be one of the reasons explaining these symptoms. Many times people come to me, they say कि ऐसा blood test करा दो जिससे पता चल जाए कि मेरे को कैंसर है या नहीं. You see, there is no universal blood or urine test which exists that can diagnose asymptomatic cancer. So it is basically good clinical examination and few of the combination of tests which are useful. But important to remember that female cancers are curable with vaccination, with breast self-examination or a mammogram and a pap smear. Pap smear is testing of the cervical area. They test some fluid from that area and they can find out what are the changes in the cervical canal. And male cancers are primarily preventable by changing your lifestyle. These are some of the tests which should be done. I am sure uh, if you are in the insurance sector, if you advise your people to include cancer screening in addition to diabetes and heart problems, doesn't cost much. So this could be a health package to begin with before you insure. And please ask your people to give or come out with history of tobacco chewing and smoking before you actually uh, do the insurance. Rather than when he becomes diseased, sick, then he says, मेरे को तो इंश्योरेंस के पैसे नहीं मिल रहे हैं, आपने ये फाइल में लिख दिया कि मैं टोबैको यूज करता हूं. मैंने कहा आपको अपनी इंश्योरेंस कंपनी में बताना चाहिए था ये चीज पहले. So people hide all this, but you should be sure about these histories. And I think a screening package should become a part of the health screening when they are insured. So now the question is, how do we make a diagnosis? Just 2, 3 slides are there. If there is suspicion of cancer, which is reported by self, means the person himself, and if he knows about the warning signals, he will definitely go to the doctor, or it is suspected by doctor. We take the history of these people, try to find out about the habits, the hygiene, and do a clinical examination, and then do a biopsy. People are very much scared of getting a biopsy done. They think that cancer spread kar jayega biopsy karne se. That is a misnomer. Then we do certain tests like a CT scan or MRI and or a PET scan, not in all cases, but some, to find out the extent of disease, and then of course plan treatment. And I must emphasize that two patients are not alike, even if they are in the same stage. And the basic principles of treatment are, if it is early stage disease, then it is either surgery or radiation. In advanced stage disease only, it is surgery plus radiation plus chemo plus some immunotherapy. There are so many therapies which have come up, and in various permutations and combinations, the treatment is given for advanced stage disease. There are certain myths about cancer. People think that cancer is always fatal. That is a wrong statement. You see, early detection, early treatment virtually cures, and you can lead a normal life. And cancer is not an infectious disease. It is not contagious. You can sit with the cancer patient, eat with him in same thali, shake hands, do anything, and biopsy or cancer surgery does not make it spread. And 90% of the cancers are painless to begin with. Pain is rather an indication of advanced stage disease. Some people complete partial treatment only and then they run away. They say, I'm feeling all right now, and switch on to complementary medicine. Complementary medicine means Ayurveda, homeopathy, because they are quite soothing treatments. I think mantra of any cancer treatment is follow the rules and the advice of the doctor. Complementary medicine is not curative, they are only supportive, and you must complete your treatment. So, what is your role? I think you must change your lifestyle. No tobacco, गुटखा, मुझे पता है कि आजकल बड़ी स्ट्रेसफुल लाइफ है. Eat right, wear right, breathe right, live right. Small family norm, of course, goes without saying. And service yourself. Service yourself means have the screening investigations. And if your children are in that age, less than 25 years, it is said maybe in India, if they are before they are sexually active, they should have the vaccination for HPV in girls only. Early detection, early treatment, you have better outcome. So you should know the warning signals of cancer. If you are working in a corporate, your corporate can donate in patient care and get involved in cancer research. And it is my appeal that you should come forward for insurance of cancer patients, at least for those who have lived for more than 5 years. We say that they are virtually cured. And cancer screening should be a part of the initial health checkup. And you should get involved in cancer journey from prevention to palliation. Means you could be a volunteer. There are many ways to get involved in cancer care, even if you are not a pro. So this is the last slide. Change your lifestyles. Take care of your body. This is the only place you have to live in. Choose life, not tobacco. Thank you.
Thank you so much, sir. That was very informative. Everybody, you have an option to raise the hand. In case you have a query, you can just raise your hand. We'll unmute you and you can get this addressed. Just raise your hand, we'll unmute you.
Pooja ji, Shikha ji, how many people are hooked? How many people are attending?
Currently, they're 41. They were around 46. Okay, so there's a
Okay.
question, sir.
Okay, okay.
So there's a question which says, which foods are known to decrease cancer risk?
Which foods?
Foods, right.
I think all green vegetables are very good. And your orange colored vegetables are very good. Try to eat as much as green vegetables as possible. And these fruits contain phytochemicals which are protective.
Got it, sir. Guys, you can put your question in the chat. We'll get that addressed.
I think it is either well understood or I have confused all of them. I don't know what is the
I
reason.
think it was simple to understand.
Okay.
So there's
Okay.
another question which says how the green tea affects. I believe
You
this is for
see,
cancer. So how does it have a good effect, on the body?
Yes, yes, yes.
Hmm.
See, green tea, the tea leaves, also contain some antioxidants,
Mm-hmm.
which are cancer protective. The antioxidants work as scavenging agents in your body. The bad elements will be scavenged. So that is how there are many scientific ways of explaining anti-apoptotic agents, antioxidant action, and scavenging action. Then free radical get removed. So many ways are there to explain this. The scientific bases are there.
Got it, sir. Thank you. Okay, so somebody is writing, sometimes we can smoke only on vacations. That's what Vakar is writing. So are you asking for permission, Vakar? I don't know.
I think ऐसा है, आग के अंदर घी डालना है तो आप थोड़ा थोड़ा डालिए, आग नहीं बुझेगी. And slowly these things become habits. People say कि मैं तो एक ही पीता हूं, मुझे तो सुबह पॉटी नहीं आती है पिए बिना. So it is a habit. And one or occasional smoker becomes a regular smoker then. So please don't even start.
Got it, sir. Thank you. Next is Yogesh Khatri. He says, how does processed meat contribute to cancer?
I don't know if you are aware, the vegetarians are supposed to have less cancers, and non-vegetarians are supposed to have more cancers. Two things amongst Jain community is they will have their food after sunrise and before sunset. So there is prolonged fasting, 14 hours, 16 hours at night. Am I right, Shikha ji?
Absolutely, sir.
Okay, this is one concept. And the other is you are strictly vegetarian. And the incidence of cancer is less in your community.
Right.
Fish is supposed to give you vitamin A and some benefits, but rest of the meat, processed or whatever way, the risk of malignancy is much more.
Got that, sir. Next is, what role does genetics play in cancer risk?
As I said, genetics has got little role to play. Only 7 to 10% of the cancers occur by genetics. Genetics means family history अगर strong है, means अगर parents को हुआ है, नाना दादा, कहीं वो जीन्स में अगर आ रही है चीज, तो down the line it'll go. I hope you have heard Angelina Jolie.
Yes, sir. I'm sure everybody is aware about her.
Okay. You see, uh, she never had cancer. Her mother had breast cancer, and her mother got herself tested for genes. It is called BRCA1 and 2 genes. They were found to be mutated. Mutated means abnormal genes. So she got herself, Angelina Jolie got herself tested for the same genes, and she was found to be positive. Positive means mutated. And she got both her breasts removed in 2013, and both her ovaries removed in 2015. And of course, the reconstruction of breast was done. So nowadays, people are becoming aware of genetic predisposition of cancer, and they are coming up with prophylactic surgeries for these. Some of the thyroid cancers, especially with the name of medullary carcinoma thyroid, is genetic. Okay. So, although if you see the larger perspective, the chances that you will inherit the disease are only 7 to 10%. But 80% of the chances that it is related to lifestyle, what you do, what you eat, what you inhale is what matters.
Very powerful, sir. I'm taking the next question, which says Ankit has a question which says, does regular exercising or yoga help to keep cancer at bay?
Yes, you're right. You see, you are burning calories, and yoga is a very scientific method of moving your body parts and keeping them healthy. So I am a strong proponent of yoga and the exercises, and definitely the chances of cancer will be less, especially by burning your calories.
Following question, sir, from Ankit, which says, does intermittent fasting help or fasting otherwise help in keeping cancer, at bay?
A man got a Nobel Prize on this issue only. Intermittent fasting protects you against cancer. You know, I think 3 years back or 4 years back, one person was given Nobel Prize for this only. And a good example is Jain community.
All right. So next question is Devinder, which says, my question is that nicotine drugs considered as good for mind, then why is it harmful for our body?
They are addictive. You see, they give you alertness, but they give you addiction. वो उसके बिना आदमी फिर रह नहीं सकता, और धीरे धीरे वो निकोटीन के साथ दूसरी चीजें यूज कर, ही इज नॉट अवेयर कि भैया मेरे को दूसरी चीजों से नुकसान भी हो रहा है. Even e-cigarettes contain some amount of the chemicals, which are in very low amount, but they are there. Okay. So if you think that nicotine will help because it stimulates your brain will get fatigued.
Absolutely, sir. Devinder still does not want to stop and he still wants to find a substitute for nicotine.
Yes, you can. Uh, you see, there are nicotine substitutes available. Don't smoke. Nicotine substitutes are available as chewing gums and as stickers or adhesive agents. So you can start chewing them or put them on your shoulder as sticker form. Slowly it goes in your body. Initially, that level of nicotine is maintained in your body. But then gradually you need to reduce the dosage of nicotine. Plus, it is the willpower of a person कि मेरे को स्मोकिंग छोड़नी है, तभी छोड़ पाएगा. चाहे जितना heavily addicted हो, person can smoke. There are two ways of leaving smoking. And even counseling and psychosocial people are there who can help you to quit smoking. There are tobacco cessation clinics which do this job. Uh, uh, so the dosage of nicotine has to be gradually tapered. There are two ways of doing it. One is you suddenly stop it, but then the chances of initiation are increased. The other is you slowly bring it down, maybe take substitutes and then stop it. And I think best way is to consult a psychologist or some attend to some tobacco cessation clinics.
Got it, sir. So I'm taking the last question from the window, which says, unusually, we see cancer detect to those who are not even smoking or drinking, and they also get cancer. How is that possible?
It is possible. You see, pollution you cannot avoid, secondhand smoke you cannot avoid. So, is it the smoke only? There are so many other things. क्या खा रहे हो, क्या पी रहे हो, क्या इनहेल कर रहे हो, कितनी एक्सरसाइज कर रहे हो? Do you have control on all those things? मुझे याद आया कि अभी भी खैर काफी जगह होता है कि अनाज जो है घर पे आता था, धुलता था, फिर चक्की में पीसने माँ जाती थी, या घर पे बैठ के चक्की पे वो किया जाता था और तब रोटी बनती थी।
Yeah.
आज पीपल आर हैप्पी बाइंग शक्ति भोग आटा और पता नहीं क्या आशीर्वाद आटा. डू यू थिंक दे हैव cleaned it? It is with pesticides, with insecticides. वो उसको पीसा जाता है और बेवकूफ बनाया जाता है, विटामिन ए एंड डी एनरिच्ड. So you are actually consuming all the pesticides and insecticides and everything with your atta. I've just given you one example. And you see fruits and vegetables so big, and you get it throughout the year. You have apples, bananas, you name any fruit is available throughout the day, throughout the year. How is it possible without preservatives? Milk, look at it. पहले वो डीएमएस वो उसका मदर डेयरी का मिल्क लाते थे, बॉटल में आता था, 1 घंटा 2 घंटे बाहर पड़ा रहे तो खराब हो जाता था, फट जाता था. आज की डेट में आपने दूध फटते देखा है किसी का भी? What is put there? Preservatives. And I'm told they put probably some hydrogen peroxide, which is a known carcinogen, in milk, कि दूध खराब नहीं हो. अरे दूध आता है टैंकर से बाहर से, क्या कहते हैं वो, राजस्थान से आता है दिल्ली में, और कभी टैंकर रास्ते में खराब हो जाए, एक दिन टैंकर रास्ते में खड़ा रहता है और फिर भी दूध खराब नहीं होता. कैसे होता है सारा? Think of all the possibilities. It is not just smoking and tobacco chewing, and everybody's body systems are different. There is a scientific explanation also. They say that everybody has got different enzyme systems, especially liver. And the carcinogens which you take are destroyed in liver and other body systems. And some are slow metabolizers and some are fast metabolizers. तो आपने स्मोक किया, मान लो 40 साल स्मोक करते रहे, but your other body parts are metabolizing the carcinogen so fast, you don't get it. But a person who has chewed or smoked only for 1 year or 2 years, he's a slow metabolizer, will not metabolize and destroy the carcinogens in the body fast. So he gets it. So actually, what is contributing? There are so many confounding factors which are causing cancer. So a non-smoker can have cancer, but a smoker will have maybe 80% chances and a non-smoker will have 20% chances.
I think that's very powerful, sir. I can't thank you enough. बहुत 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 शुक्रिया for having this session today. It was really a pleasure to have you here today.
Thank you.
Thank you, everybody, for your time and attention. We hope this session has provided you valuable insights and a deeper understanding of cancer awareness. Together, we can make informed choices and support one another, leading healthier lives. I
Thank
know
you.
some of you logged on late. This video is going to be uploaded on the portal. You will have an access, for that. So you have not missed out onto anything. You can go to that portal and you can check out the video. Thank you so much, sir.
Thank you.
Ready? Bye-bye.
Bye-bye. Bye.
Mm.